What happens when a trained solutions engineer applies their deep technical expertise along with strong communication and customer-focused problem-solving skills to address Black male mental health? We'll hear from someone who has used their lived experience as a foundation to do just this. Up next on this episode of the Psych, Health, and Safety USA podcast. From Flourish DX, this is the Psych, Health, and Safety USA podcast. As workplace mental health has become a global priority, there's a greater focus on addressing psychosocial hazards. Each week, we look at psychological safety from an occupational health and safety perspective. Let's talk psychological health and safety. Welcome to this episode of the Psych, Health, and Safety USA podcast. I'm your host, Dr. I. David Daniels, and I want to thank you for tuning in. Our goal for each episode is to increase awareness of the importance of psychological health and safety by learning from the lived experiences, research, and expertise of our guests, as well as advocating strategies to reduce harm and minimize vulnerability to psychosocial hazards in the American workplace. A solutions engineer is uniquely positioned to bridge technology and human need. When it comes to Black male mental health, their role isn't clinical. It's about building systems that make care accessible, trustworthy, and culturally relevant. They can design platforms that connect men to culturally competent therapists and peer networks, ensuring the interface feels safe and intuitive. They can integrate data from surveys, wearables, and community programs to highlight stress patterns and track outcomes, providing advocates with the evidence they need to push for change. Solutions engineers also safeguard privacy, which is critical for men who may hesitate to share sensitive information. By collaborating with community leaders, they translate lived experiences into technical solutions. Whether it's a mobile app for early warning signs, dashboards for program impact, or virtual workshops that teach resilience and hazard recognition, the bigger picture is empowerment, shifting mental health from the individual burden to a community-supported system. With their blend of technical mastery and empathy, solutions engineers help engineer trust, usability, and dignity into solutions that allow Black men not just to survive, but to thrive. And these types of conversations, some might be surprised to come to the Psych, Health, and Safety USA podcast to hear this type of conversation, but where else are we going to have it? It is not enough to simply talk about psychologically safe spaces and workplace mental health and all of that. If we don't have systems to cause that to happen, it's not going to be near as effective. And it is my honor and pleasure to have someone who knows about that, who is a solutions engineer and has a story to tell in this area. So let's get to it. And I tend to get to it with an introduction of my guest, by my guest, with this question. Who is Peuge Benjamin?
Well, thank you for having me on the show. This is definitely something that I've been telling myself I want to do more of, and the universe just brought us together. So, who is Peuge Benjamin? Peuge Benjamin is the son of two immigrant parents from Haiti, First Republic, born and raised in Brooklyn, New York, and transitioned into Philadelphia for high school. I'm a shy kid, introvert, who has kind of gone his way through life pleasing others. I've joined one of the most amazing organizations in the world, the Omega Psi Phi Fraternity Incorporated. And as you know, our motto is friendship is essential to the soul. And I say all that to say my roots are deep in community, are deep in belonging, are deep in the things that most of us as Black men desire, right? How often are we constantly like, hey, when are my boys available? I want to link up, right? We yearn for those guys' night outs and stuff like that. Fast forward, I am a mental health advocate. My goal is to help others understand and get past the negative stigma that mental health has, right? Especially as the Black and Brown communities within the diaspora and on the motherland, we believe that mental health is for somebody with, who's losing it or who's walking around talking to themselves, right? And that's not the only way that mental health shows up in our communities. As you mentioned earlier, I'm a solutions engineer. From the age of 10, I remember taking apart my first computer, Packard Bell. Parents paid about $2,600 for it. Decided to take it apart while they were away and rushed to put them all back. And our people have a tendency of when we put things back together, there's usually like extra pieces laying around. So as long as the thing was working, I was good to go. And that literally sparked my curiosity for fixing things, right? And when you look at things from the 1,000-foot view, you're able to see how everything is interconnected. And so as a solutions engineer, my job is to come and solve the problem. I fly up in a 1,000-foot view. I look at the problem, look at the landscape, and identify areas of improvement. And if there's a gap to be filled, I develop solutions to fill in that gap until it's available in the product. So I hope that answered the question, who is Paige Benjamin?
It definitely does. It definitely does. And I think we're going to have an opportunity over the time that we're communicating here to get into a little bit more detail about some of those areas. But one more standard question, and literally every person who comes on gets to answer this one. What does psychological health and safety mean to you?
Oh man. So as color folks, I think psychological health and safety um is finding places we belong and feel comfortable in, right? To be safe. I think for us, we are constantly not in a psychologically safe environment due to microaggressions, due to prejudices, and prejudice is not necessarily in a racist connotation, right? Just people having these preconceived notions of who we are. And we are no different from anybody else. We work, we look for validation. We are trying to put our best foot forward most of the time, if not all of the time. And so it's literally the fight that King Martin, King Malcolm, and so many others have fought for is, hey, just treat us like you treat everybody else. So what does psychological workplace safety look like? Me coming to work and you just treat me like you treat John. Hey, John, you have these deliverables. Where are we with it? Versus you give the one of 1,000 black guys, right? Hey, you're gonna have the hardest task to accomplish because we believe you're just so great at what you do. Meanwhile, Johnny over there is kind of doing the bare minimum, right? And so I think it's an even and fair playing field. But once again, we perceive and we've acknowledged that we're such a resilient people that we take the charge willingly, right? What's the phrase? God doesn't give us anything that we cannot bear. And so when we come out on the other side, we may be frazzled, we may be frayed, we may be a bit bruised, but what we are is that much more skilled to the next level.
Mm, mm. Yeah, yeah, you're ringing some bells for me there. Oh boy. You talked a little bit about in your intro of yourself about being a solutions engineer. I have to be honest. Until I met you, I'm not sure I knew what a solutions engineer was. I certainly have never met one before, to be quite honest. As I think about it, it kind of it kind of makes sense. But what is a solutions engineer? I mean, what's the technical what? And how did you come to decide? After you took the computer apart, how did you come to decide it was something you were interested in?
So the role of solutions engineer is, I honestly, it's God given title, and I'll explain it a little bit. My background, went to University of Pittsburgh, graduated with a poli sci and a psych degree, then went on to University of Phoenix to get my master's degree, then went on to University of Phoenix again to get my MBA. Now, in that process, my first job out of college was working for a nonprofit. And if you've ever worked for a nonprofit, you have to do 3,000 jobs plus your job, and then what's the fine print? All duties as assigned. And so for me, I started as an intern in the help desk, and pretty much within my first year, gravitated to network administrator. And so I am about 22 years old, and I'm responsible for an entire child welfare agency's network, right? And this is my second year in. Now, um, this would not be possible without amazing mentorship, without amazing belief in myself, and without countless nights of just um, doing my due diligence to be great at what I do. I think one of the things that we run into, and I'm answering the question, but giving some paint to it, right? One of the things that we struggle with sometimes is determining whether or not we deserve to be in certain spaces, right? And as a 22-year-old now responsible for an entire network, I'm like, wow, this is a huge responsibility, but this is one I asked for, right? So I did a lot of research, made sure I tapped into my mentor, and made sure that, I was doing the things that I needed to do. Now, fast forward, um, I am looking for a job because, nonprofit, it will wear you out. Um, and so the first thing I started doing was just applying. And I got a call for a job that was literally out of the blue. I don't remember applying for the job. I don't remember the job title, but when I got to the office, I sat there, waited for my interview to start, and when I started my interview, it was like a firing squad of like 8 people across from me, right? And I just remember there are red marks all throughout my resume. And I'm like, oh man, that can't be good. Now, I want to back up a little bit. As a network administrator, I was responsible for email. I was responsible for the network. I was responsible for procurement of software, procurement of hardware, procurement of staff, right? Just hiring help desk staff. I was also responsible for all the telecom. I was responsible for communications going in and out, our website, our Blackberries. So you name it, that's part of a typical organization's ecosystem. I was responsible for it. Now, the one thing that I was also responsible for was our antivirus system. At that time, Symantec. We all heard of Symantec before, right? So fast forward to this interview, the job was for Symantec endpoint managing director role or manager role. And I guess I wowed them very well that they were like, look, we initially hired you for this role, but we have this new thing coming out, which is called mobile device management. And we think with your experience and your skill set, you can help us build out that team, right? And so, with that being said, and this is a good point to note, we all have transferable skills, right? We all have a skill that we can take into any industry and be great at it, right? So the role that I was in was a mobile device management professional service engineer. And we all know what a professional service engineer is, that person that's a subject matter expert in a particular software or particular system. And so for me, I like, once again, the team was brand new. Like we had nothing. And I put on my nonprofit hat and try to I literally jerry rigged 2 laptops next to each other, treated them like servers, and got the software running. And everybody, including the software vendor, was amazed. Fast forward from there, I was also, feeling unappreciated. And as I mentioned earlier, sometimes they look at us when we ask for what we want. They're like, we're not sure if you deserve that. So that was the time for me to start looking elsewhere. Um, I looked elsewhere, found me a job with JP Morgan. They were in the midst of furloughing that following fall. And I reached out to the vendor that I was previously working with. And I was like, hey, do you know if you guys are hiring? He said, why didn't you reach out to us sooner? I was like, well, I did, I'm a stickler, if that makes any sense. I didn't want to cause any like conflict of interest or make it seem like they were poaching me. So I wanted to do at least a hop and got on the phone with him. Within 3 days, they gave me a job. So I was a mobile device management solutions and mobile device management professional engineer. Now, in that role, our job is to secure mobile phones, desktops, laptops, tablets, you name it. And during the pandemic, we were probably one of the few busiest organizations outside of Zoom, Teams, and all of those Citrix and so on and so forth. Our job was to secure phones. And unfortunately, in some cases, our job is to secure tablets so families can tell their loved ones goodbye, you know? And so I really took what I did to heart. And once again, another transition in my life, company was acquired and it was time for me to kind of, move on. And keep in mind, in between, I'm not one of those every 2, 3 years I'm looking for a job. If the company is good to me, I'm usually good to them. I stayed with the nonprofit for about 8+ years. I stayed with the job after that for about 4 to 5+ years. And then with the job that I was with previous to where I'm at now, another 8+ years. And so it's not that I'm just jumping from job to job. So the solutions engineer role, I didn't know what it was either. I'm not even going to lie to you, right? And the solutions engineer role is really a solutions architect. It's an architectural role. It's an individual that knows how to put things together in a way that's the most efficient. This role, I was literally hit up on LinkedIn, and if many of you have been hit up on LinkedIn, you're thinking this person is just like reaching out and bothering me, trying to get their numbers up. Told me about the opportunity. I kind of shrugged it off, and then they reached out again. So I was like, at this time, let me make sure it's for real. How much? How soon are they looking to hire? And when's the interview? And they answered me with the right numbers and the right time and the right everything. And I want to say 2 weeks later, I'm a solutions engineer for SiriusXM. So I know that's the long way about how I got into it, but there is no one way to get into a lot of these IT positions. I think it's all about, do you have the transferable skills, as I mentioned earlier, to do the job, to do the job functions. And it's like similar to what you do. It's, can you do health and safety in a pharmaceutical company? Can you do it at a construction plant? Can you do it at and so it's just about take person here, replace industry here. And in most places, it's just title changes. So, for example, a manager at a bank would be called a VP because they probably make 100,000 plus, but they'll be called a manager anywhere else. So it really depends on the industry you're in, and what the titles are used for. And so the short answer to the long response is, it was a God-given title, to be honest with you. Not one that I went to seek, but I think along the way, God saw that there was something that I needed to experience, I needed to have for myself, and it was something that set me up for what I say today is probably my most blessed point in time in my life.
Yeah, that again, some might be surprised about the direction of a conversation like this. So solution engineers and IT and technology and all that type of thing. So stick with us, folks, because there's a connection here. And so let's get into a little bit more detail. What, in your view, makes mental health a unique challenge for Black men?
Oh, wow. Do we have enough time for that? That's the question. um, I don't want to get too. I don't want the audience to feel like we are harping on something that is irrelevant to the discussion, but we do need to talk about it. And call the elephant in the room out, right? You know, over 400 years of slavery, being displaced from our country, our home country, being emasculated in order to control the family, segregation, Jim Crow, George Floyd, so on and so forth. So there is a history of the Black man being used as an example to kind of keep the community quiet or down, right? There's systemically trainings on how to handle a Black man versus how to handle a white man or a Hispanic person or an Asian person, right? I think we're historically seen as a threat, whether it's direct, indirect, implicit, or explicit. And so we are constantly traversing a world that we don't know what the other person is thinking, right? In certain communities, you're walking down the street, somebody walks across the street, you already know what that is, right? In other communities, they walk right past you, nothing's wrong, but you don't know what that is. I'd rather in a vote racist or a revolt bigot or a revolt somebody versus somebody who is kind of, hiding it, because you at least know the devil you're working with versus the one you're not. And so for us, because we're constantly on, like we have to turn on the head on a swivel, watching the door. Think about it, right? What are the things that you're told as a Black man, a young man, right? Never have your back to the door. Always make sure you identify the exits. Make sure that you look a person in the eye. Make sure you're saying yes, sir, yes, ma'am. Make sure you're polite. Make sure you're not inconveniencing others because it could potentially create you harm. So I say all that to say we have a lot to worry about on a regular basis. And that's before we even bring in a mate or children in the world, right? Just to walk outside the door ourselves, we are constantly on high alert to ensure that, one, we're not positioning ourselves to be in danger. Two, we are able to make it back home alive.
Right. Right. Yeah. I talk often from a safety perspective about the difference between being safe and feeling safe. They are not the same thing. There are circumstances and situations that, if you look at the particular hazard, and here we talk about psychosocial hazards, but even if for a physical, and it really doesn't matter, the that hazard may not be present. I may not be exposed to it, but I still don't feel safe. There's something about it that I don't feel that way. It's like when people talk about, crime statistics and all that type of thing, there are folks who they decide where they're going to place businesses, decide where they're going to build homes, decide where roads and bridges go based on crime statistics that are not really what's going on. Because if you look at the numbers, even in the United States, the crime rate has, really either been flat or declining for the last 30, 40 years. We are not near as violent even though we see more of it because of media, we are really it used to be back in the day that, particularly, for example, take the example of a Black male in certain parts of the country in the 20s and 30s, who looked the wrong way at the wrong person and found themselves executed at midnight hanging from a tree. So again, we are certainly, and truth of the matter is that that idea that the lynching was not illegal either. It only became a federal hate crime within the last 5 or 6 years, thereabouts, certainly the last 10. So again, these are feelings that we carry because of our experience and because of what we've been told by our parents. And, whether it's actually going on or not is kind of irrelevant because we make our decisions based on how we feel. And when I come into a space and it feels funny, or it doesn't feel comfortable, or it doesn't feel like I can be at my best, all that stuff comes back. All those stories that I was told when I was told by my mom that you're going to have to be twice as good as the other person in the room because, or you're going to have to work harder. All those things come flooding back. And guess what? I'm not, we've never, we have still to meet in person. We will, but we were raised in different places in the country. I have had more birthdays than you, but we still have a similar cultural experience because of the country that we live in. So for those who want to dismiss it and say it's not that big of a deal, it may not be that big of a deal to you. You may be able to show me all of the data that says, all of the quantitative data that says, well, these types of things don't happen. It still doesn't feel safe to me.
I want to add to that. So, there's a fine line on how we should respond to our feelings, right? I think we should acknowledge them, although acknowledge them, realizing that sometimes our feelings aren't real, right? And we understand that, and I want people to understand, like, although what we're feeling may not be our reality, it also is what we leverage to be vigilant, right? It's not we don't live out of a place, these feelings don't put us in a place of fear. It puts us in a place to be cognizant of where we are, who we're interacting with, and understanding how to have and if we have the gift of discernment, understanding who's in the room and how to identify how to interact with people that's in that room. So, that a lot of times, therapists will be like, you're feeling this, but, is your feelings your reality? It was like, once again, I'm not saying it's not my reality, but I've seen it. I've seen it firsthand. During the pandemic, we've watched it firsthand, unfortunately, over and over again. And so are we a bit more risk averse than most? Yes. Do we have reason to be a bit more risk averse? Quite often, yes. And so I just want to make sure the audience understands we're not using the risk to live in fear. The risk or the feeling to live in fear. The feeling is to ensure that we live a risk averse life and ensure that we are in places that we feel safe and we create safe spaces for others around us so that they don't have to have their head on a swivel. Like if I'm out with you, David, I don't have to look at the door. I don't have to look and see, how many people are in the room or where the exits are, because I know we're creating this relationship that if you see something off, you're going to be like, hey, Paige, let's take a step out. I don't think this is the right place to be right now. And I think that's what we really want to make sure we drive in is we're vigilant. We're not scared. That's the difference.
Do you need more psych health and safety in your life? Then head over to the Flourish DX Academy for several free on-demand e-learning courses. If you're an internal professional, follow Flourish DX on Eventbrite to register for any of our free fortnightly interactive webinars. Our flagship professional practice program is also exclusively available for internal professionals. The 12-week course blends theory, applied practice, and interaction with other professionals through live lectures and a monthly community of practice session. Find out more about all these learning opportunities or inquire about a bespoke in-house training at the Flourish DX Academy. www.45003.org. Now back to this episode.
Well, yeah, absolutely. And, again, the definition of a psychosocial hazard is a psychosocial factor perceived or experienced by the person exposed to it as somehow threatening that motivates my behavior. So it is my perception. You didn't feel it was a thing. I did. And that perception and that experience, what I've seen in the past, that causes me to look at it differently from you. And so when we talk about the workplace, a lot of our workplaces were built for and by, and I say this often, a good percentage of our institutions were built for and by 8% of the global population. Yeah. They were. And that doesn't make it bad or good. It just makes it limited. If if the person who created that space was male or female or white or black or Asian or able-bodied or disabled, they bring their perspective to that thing. They create it in a way that feels comfortable for them. And I'm not here to bash that at all. I'm here to suggest, though, when you bring in different people, we got to have a conversation about how that affects me. Because this idea about, oh, you got to assimilate. No, actually, I don't. I got to bring my knowledge, skill, and ability, but I'm not sure I want to assimilate. I mean, and that's I don't really want to be in the melting pot. I don't want to melt down so you don't recognize me. I want to be me. I want to do it my way, just like you want to do it your way. So we need to have a conversation about how our differences are gonna, like gears, how they're gonna coexist and drive the machine, not how I'm gonna, shrink and back up and be afraid. No, I'm not doing that. I'm not. I'm not going to do it. We have, and you mentioned some of their names as we started this conversation, but we have people who have lost their lives to fight so I didn't have to worry about getting hung, or I could vote, or I could speak my piece, and I have the right to free speech. And there are people who died for that stuff. And no, I'm not going to back down. And I'm also not going to come into a workplace or any other organization, feel unsafe, and just simply let it be that way and it'll get better. No, we need to have a conversation about that, and something else I'll say is that I've done the research. The average person in the workplace in the United States, and I could find data back to the 60s, stays their job about 5 years. There's a reason that people leave, and often they leave because it doesn't feel safe to me. It's not that I'm a great worker. I'm really good at what I do, but this environment isn't safe to me, and that safety doesn't always look like, it's not like somebody grabbed my collar. It's the words that were said. It was the things I was excluded from. It was the way I was looked at. And I said, well, yeah, these things are going on in my head. And again, we just need to have a conversation about it, because you couldn't possibly know all this about me because we're two different people. I get it. The issue is when I bring it up and you minimize it. When I bring it up and and again, we got into this conversation when I asked the question about what makes mental health a unique challenge for us, for Black men, it's because we've had a different experience. And again, I am not here to say that everything in the world around me is done against me. Not all of it. Now, some of it actually was. I won't be naive there either. Some things were done specifically to ensure that Black people and Black men were marginalized and emasculated. Some of them. Now, not all of them, but some of them. But the things that do that starts to cloud my perception about a lot of things. And while you and I may not be fearful, there are some that are. And, and again, I think we need to have these conversations about it is different for people. Do we want people to feel safe and be safe and have, be resilient? Well, we have to help them be resilient in the way they're going to be resilient. Not simply, you got to do it this way. No, what really works for them and what's going to help for them.
So I want to add to that real quick. So my nonprofit, Get My Cheese Back on My Cracker Foundation, as I mentioned earlier, it's focused primarily on removing that stigma about mental health, around mental health in the Black and brown communities. But it's also about creating communities, building safe spaces, right? Within that, we've created, specifically for the Black men, a community called the State of the Black Man's Mental Health, right? And the idea behind it is, one, humanizing the Black man, right? I think far too often we're looked at this, larger than life, gorilla type person where we are probably the most dangerous person in the world, to like, no, I was raised by two parents, or I was raised by a single mom, or I was raised by my grandmother, and I followed their principle through life, and this is who I have become because of them, right? We've all fallen short of being perfect. Nobody's perfect. But what's important for our organization was having the difficult discussions, right? Before we started the State of the Black Man's Mental Health, our show was primarily a podcast focus on having these difficult discussions, right? How do Black men and Black women talk about mental health within the community? It's through an open dialogue and respect for one another. Because without that respect, regardless of who is right or wrong, the point gets missed because nobody's listening to hear each other, and we're just listening to rebut. And so through these conversations, as you mentioned, these difficult, like this one, these difficult conversations, it's the work and the impact that we need to start to look at. What is the work that we need to do? So we focus on going into communities and presenting mental health professionals to community members. I'm like, hey, this is a therapist. This is a mental health first aid person. This is a psychiatrist. This is a counselor. These are what they do. This is how they operate. And I think as we start to have these open dialogues, it allows the community to lessen their guard and be open to one, not just the conversations, but seeking help. Because the other side of the conversation that you're bringing up is Black men asking for help, right? I think you and I are, even at our stages, individual stages in our careers, have built up the momentum to stand up and advocate for ourselves, right? We have young Black men coming out of college that don't feel like they can say, I can't endure that. I have to X, Y, and Z. And we have to have the conversation to say, no, you can, right? Because think about it. It took a lot, like, once again, you got a few birthdays over me, right? You probably were able to acknowledge that maybe 10, 15, 20 years ago that, look, enough is enough. I don't need corporate America, right? It took me 4 years ago or 3 years ago to start to have that. And I think the advocacy is a nerve that we build, right? To say, hey, look, even to your point, every 5 years we're moving around. The reason is either there's acquisitions occurring and they're cutting staff. And I'm just talking about today's landscape, right? Your company's being acquired. We're worried about finances. We're cutting costs. We're doing these things. And the first people on the chopping blocks look like us.
That's right. That's right. That's right. That's right.
You know? And so now what do we do in order to kind of circumvent that or prevent that? Unfortunately, a lot of our brothers and sisters are overworking themselves so they can seem as invaluable to the organization, so they're not the ones being cut out.
That's right. That's right.
Right?
Yeah.
And now what do we do? What can we do to advocate for ourselves in these spaces? And I'll use myself as an example. I recall, having a conversation with my manager. It was like, hey, I'm a bit concerned around the direction of the organization, and I'm fearful of we might start experiencing cuts, especially from our department. And once again, he reassured me. He's like, no, like our department is good, but I see where you're coming from and I'll address it. Because if we don't address the concerns, right, and advocate for ourselves, it just gets worse. And so when the cuts come, you're surprised because you didn't do your due diligence, and I'm not saying it's your fault, but we do have to see the writing on the walls. Like, let's read the shells. They're there.
That's right. Yeah. Again, that definition I brought up earlier, so the management of change can be a psychosocial hazard. It is no different than you brought a chemical in that I'm worried about, getting exposed to. You decided you were going to change, and you didn't include me. You didn't really share. I didn't get to help design the solution. You did it kind of all on your own, but it's going to affect me. And that can be stressful for people. It can be stressful for people. And again, to a point that you made earlier, it can be stressful for me. And if I have not had the opportunity to learn resiliency skills, I'm in fight or flight all the time because I'm used to live my life in fight or flight. And every little thing, as much as I share with people, I believe I'm a Gen Zer that was born 37 years early. And I see and empathize quite a bit to Gen Zers, how they feel that, I don't want to work someplace that's doesn't align with my values and all that type of thing. That's one side of it. But the other side of it is you got to eat. And you can't simply, if you're going to be triggered by everything, you're not going to eat because people will use that against you. They know, well, either they know or they've observed that if I do a certain thing, Paige is going to respond a certain way, and I can control you that way. So this is a two-sided conversation. I have to be able to recognize what peace and joy and contentment means to me and how important that is, and then make a decision about how much of that I'm going to allow to be threatened in this environment. Because, back to your point earlier, I'm not saying that corporate America or any other job is good or bad at all. I'm not saying that. The question is, how much do I value my own peace and joy and mental health and contentment? How much of that am I willing to put on the line for that? And for some, there's not enough money in the world for you to do certain things to me, period. I don't care. You could offer me $7 bazillion, and I'm not going to do that. I think we all have a number that we'll put up with certain things. I tell people all the time, I spent 30 years going into buildings on fire. So they told me the building was going to be on fire. I wasn't surprised. But there were some things I wasn't going to do because I don't want to get killed. And the same thing applies to our mental and emotional wellness. There's some things, is your mental health important enough that you aren't going to put up with that thing? Because we've all got a level.
Well, I do want to, just tap into more of, the mental health side of things right now. So one of the things that we struggle with is, and this is irrespective of an industry, is we have a lot of boomers still remaining as managers, right? And I think management is most professions require continuous education, right? Most doctors require it, lawyers require it, engineers require it. And when I say engineers, like your industrials, like people who are dealing with like life-threatening things require continuous education. And I think management, there are times where they're stuck in the way they used to do it, or this is how it's been done. And that you run across a Gen Z or Y or millennial, and they're like, no, I'm not gonna deal with that. And so, what we're seeing today is a revolution around how people are willing to, what people are willing to accept and not accept, and really a call for, let's reassess what a manager's role is, and let's reassess what managers are capable of doing, because you have to be able to see that your staff are different from you. You have to be able to acknowledge that your staff learns different from you. They receive direction different from you. Just because your management is screaming, hollering at you doesn't mean you then pass that straight through and screaming, hollering, because that's an easy way for a rotating series of staff. And you wonder why I can't keep a staff member. I remember my first couple of weeks at the job I'm at now, we had a young dude, 22 years old, fresh out of college. I think this was his first real job. He didn't understand that. He didn't understand like the commands that you're receiving really isn't like the manager's command is like the way it's being pushed down. And some managers don't know how to just soften the blow going downwards.
Yeah, absolutely. And organizationally, these systems have been set up to be that way, and somebody's got to say that's just not going to work for us. That's not, and not only do we need to change the way this particular manager does this, and then back to your point, the entire system needs to take a look at how are we going to get the best out of the people that we say we want to work here. We say we want Peuge Benjamin to come. He's a great software engineer, a solutions engineer, or whatever. If it's a custodial position, it doesn't matter. You said you needed and wanted that person to come and work and be a part of your organization, but then you create an environment that makes it so difficult to do, and you wonder why people are leaving. And let me add this one in here. You notice that there's a trend. Why is it that it works really well for one group of people And we can't seem to keep that other group of people because there is a systemic obstacle that you've just not addressed. That's all. I'm not saying you're a bad person. I'm not saying you even doing it intentionally, but it doesn't work for everybody. And so we've got to be having these conversations about how this thing is even structured and how people talk to one another and how they interact with one another, because it doesn't necessarily work for everybody.
And if you look at how the job market is today versus how it was in the past, we would probably do what? Maybe 1 or 2 interviews. Now you're doing a manager interview, you're doing another manager interview, you're doing a team interview to see if you fit with the culture, then you're doing another manager interview, and then so by the time people are done, they're exhausted. And it's like, if I've made it through all of that, why continue to give me grief on the end, on the other side, once I'm
Right,
there?
right, right,
You know?
right, right.
And so I think there's a traumatic experience in going through the interview process. And
Yes,
by the
yes.
time you come out on the other side, the assumption is, I'm good. You guys hired
Mm,
me. But
mm,
then the culture, to what you're pointing to, says, no, we still need to keep you in line because we want you to know you're the last in and first out. So anything you
mm,
do, we could potentially replace you. So,
mm.
it's a weird place to be today. My wife was laid off, and 18 months passed, she couldn't find a job.
Mm.
Right. And so I was like, babe, we got to put your entrepreneur hat on. We got to figure it out, you know?
Mhm,
And
mhm.
thank God. And, there's a theme in everything. We're blessed. Right. Thank God I had my job to cover us, but
Sure.
also thank God for the people around us, because she became a consultant for a friend of hers. And, it got to the point where, they started doing a little consulting work, and then they were like, I don't know why you're not working for us. And now she has a full-time job with them,
Right,
and so I
right,
think
right.
we also have to, and everyone's not made or built to be an entrepreneur.
Sure.
Everyone's not built to go out and start their own businesses. But I think we do need to start working and looking at how do we do what our counterparts do. And
Yes.
that is build a table and invite our own.
Right. Right. Yeah. Yeah. And so as we start to wrap, I want you to spend just a few moments talking about that concept of creating our own table. Tell me more about how that concept kind of interweaves into the work that your nonprofit does.
So, creating our table starts with us understanding what's the need for our communities, right? Safety first and foremost, acknowledgement of who we are as individuals, as human beings. And then once we start to do that and understand that and acknowledge each other, we can start to work with each other and figure out what each other does. Right. So if I know that this person's a programmer, and I know this person that does help desk, and I know this person wires server rooms, I think we could probably come together and put together, if not a partnership, right? We put something together and put it out there in the ether. It's like, all right, hey, David, do you need a website? Do you need, do you know anybody that needs their server room rewired? All right, I got a couple of people that could work. I mean, back in the day, we used to rotate the dollar within our own community so many times that it was ridiculous, right? But today, there are unfortunately some outliers in our community that makes it a little difficult for us to trust one another. But I think we need to get back to the place of, hey, if I know you and you know me, let's start to see how we can work together. And so what that means for our organization is, my wife reminds me all the time, like, you can't do everything by yourself. And it's important to understand that if you want to go far, if you want to go fast, you go by yourself. If you want to go far, you partner with others. And so as an organization, our goal is always to partner with other community members to help them understand, like, look, we see you, we acknowledge you. We know that you understand the plight of the African American and Brown community, and we want to put you in front of others, which is why we work on building out a directory of Black-owned businesses that are culturally competent and provide different services, whether it's mental health services, whether it's financial services, you're a roofer, you're a nail tech, because guess what? We may not be able to rebuild Tulsa, Oklahoma, but we can do it virtually. We could do it in a way that, you know what, I got a referral for a plumber, and I'm gonna let you know he's a great dude. He did work for me, and I'm gonna do that. We're afraid to share our resources, right? Because if my plumber gets busy, now I can't get him when I need him. Well, we could figure that out. How about we get that plumber to bring on an apprentice that he can teach and train? How are we building the table, to your question? I think we're the way we bring people to the table is leverage apprenticeships, internships, fellowships, the ships that allow us to set somebody else so we could set them sail so they can go do that for somebody else. Um, the phrase is lifting as we climb as the talented 10th, right? It's not lift as we climb or talented 10th. I think we should lift as we climb as the talented 10th, because as the talented 10th, we've gone past what the 90% couldn't have. So how do we go back and teach the people how to get to where we were, or at least how to get past from where they are today?
Wow. Wow. Yes. It's such an important message. These psychologically healthy and safe spaces need to be built. They need to be constructed. These communities need to be constructed because they aren't inherent. So even this idea about, people from all over the world coming together and creating a country, or being brought here to create a country, or being, not to get too much into that, but that doesn't happen by accident. And it also you don't create safe spaces by you creating something, dragging me into it and forcing me to do it your way. This has nothing to do with your intent. It just doesn't match what I need. I need something else. And so, I think it's very important that we use our dollars to support, these kinds of thoughts about what's safe for us. I say this often, particularly when I have service interactions, when I do restaurants and that type of thing, I ask the people that work there about what does it feel like to work there. I do. And whenever people who go out with me a lot, they know, are you going to ask them? Because I do. Because if you are mistreating the servers and the cooks and the people who are, and the people who are taking your order, if you'll mistreat them, why am I going to come give you money to mistreat those people? I'm not going to do that. I'm not. I'm just not going to do it. I'm not going to. I do not support businesses who mistreat people, and I know about it. Now, there are some cases where these organizations are so big and there is no competition. I'm kind of stuck with them, but I'm always looking for alternatives. And the alternative is about not only do you give good service to me, because if I don't get good service, I'm leaving, period. I just tell you. I mean, but I'm not also going to sit around and watch you mistreat people so you can get me something a little bit cheaper. I don't personally want to do it. And I think I share that with other people. We should want to be in spaces where we are valued, where we are supported. And again, we agree on everything either. But when I go to get a service, I should know that group or that person has a similar view on how other human beings should be treated, and particularly when the human being looks like me.
Yes, I agree. I agree wholeheartedly.
That ain't a lot to ask. So, if there are folks who have heard all that you've shared and they want to learn more about you, particularly about your nonprofit, they want to reach out and they want to keep the conversation going, what is the best way to do that?
On all platforms, cheeseonmycracker.com. On all platforms, Cheese on My Cracker. Our website is cheeseonmycracker.com. You can find me, Peuge Benjamin, on LinkedIn, on Facebook. I'm all about sharing positivity, things that people want to experience. The other piece that you'll learn about me is I'm an avid traveler. Part of what gives me the perspective that I have is being able to see 38 countries of the world. and seeing how people live from the rich of the richest to the poor of the poor, and having a perspective saying, I'm fortunate. I'm very fortunate. And then, on top of that, you'll see my beautiful wife in every picture because she takes them all. And, I think that's the other thing I want to also touch on is that, as Black men, we can't dismiss the impact of the women in our lives, the women in our communities, because I know there's a lot of amazing Black men out there that was raised by their grandmothers, that was raised by their moms, who did the best that they can to make a Black man a great man who they are today. And so I just want to make sure that people understand, like, yes, we are out here doing great things, but it's not without a strong, resilient, patient, forgiving woman that made sure that we had what we needed. And somebody always reminds me that as men, regardless of color, there's a balance of the masculine and the feminine. And we have to be able to understand that with all the masculine traits, we have to be willing to tap into our feminine traits. And that's compassion, that's caring, that's emotional intelligence, that's being thoughtful, that's listening. It doesn't make us weaker. It actually makes us stronger, and it makes us better human beings all around. So just wanted to end with that.
Right. Absolutely. Well, Paige, thanks so much. Thanks so much for what you shared. Yeah, a true solutions engineer. I got to tell you. Yeah, thanks very much. So if you're watching or listening to this podcast for the first time, welcome. I hope something that you've heard will bring you back to an episode in the future. Previous episodes of the podcast can be found at psychealthandsafetyusa.com. You can watch, like, subscribe, and share the podcast on the Flourish DX YouTube page. And please join the Psych Health and Safety USA movement by connecting and becoming a subscriber on LinkedIn. So until next time, stay tuned and look out for the next episode of the Psych Health and Safety USA podcast. Tune in each week for new episodes of the Psych Health and Safety USA podcast. If you have a story or know of one that needs to be told, reach out to us on LinkedIn or send an email to david@id2-solutions.com or go to the Flourish DX website at flourishdx.com. We'll see you next time.